One of the most common reasons families come to see me is this. A parent, often in their 70s or 80s, has become forgetful, withdrawn, and less themselves. Nobody's quite sure what they're seeing. Is it depression? Is it dementia? Or is it both? I'm Dr. Max Malik. I'm a consultant psychiatrist specialising in adult and elderly mental health. And this is one of the most important distinctions I make in clinic because the answer changes everything that happens next. Why does this matter? Well, because depression in older adults is common, but often under-recognized, but it is very treatable. Dementia is also common, but also under-recognized, and in its earlier stages, it can really benefit from early identification and certain interventions, even if it can't be cured as such. Sometimes the two exist together, and that's quite common. Sometimes depression mimics dementia, and early dementia is mistaken for depression, sometimes for many years before the right diagnosis is made. Getting it right is not just an academic question, it determines the priority of treatment such as antidepressants, talking therapies, lifestyle changes, cognitive support, advanced planning, or a combination of these, and it can be very different for each individual. How depression dementia can look can be similar. Both can present with low mood, loss of interest, being withdrawn socially, thinking is slowed down, poor concentration with difficulty in sleep, weight and appetite changes, and sometimes memory problems. In older adults, depression often shows up with less obvious sadness, but it can show up as apathy, irritability, physical aches and pains, and physical health symptoms, and sometimes the people are just switched off. And sometimes there are physical reasons for this, such as thyroid or vitamin B12, amongst others, that may overlap, and the careful assessment really can tease this out, and that's why we specialise in these things. And they can be separated and treated and managed separately. How I approach the question is in a detailed history, when it started, how it evolved, what was first affected. Depression typically has a more identifiable onset, with mood, motivation, before cognition being affected, an effort on testing that can be variable so we can get different results, but this is part of the assessment. Dementia is more insidious, it's gradual, it's slow, it can happen over months and years, and it's an underlying neurological condition rather than just simply a change in mood. But I review the whole person, including things like physical health, medication, alcohol, sleep, hearing and vision are really important. And then I use validated rating scales for mood, structural cognitive testing, and if needed, then I arrange neuroimaging and blood investigation. If the picture remains uncertain, and sometimes the cleanest answers are trial or of treatments such as antidepressants if indicated, and if cognition and memory recovers with that, then we know that's something perhaps related, more likely to do with depression. But as I say, they can often coexist. So if you or your noticed an older relative who are not so sure and they're feeling a bit different, not classically depressed maybe, but withdrawn, socially isolated, not able to do things they were able to do, then we should consider both depression and dementia. That's because both are easily treated if recognized early and managed appropriately. And if you'd like to book in for an assessment, then contact the Health Suite.